Okay, I'm just going to review the Alaris pump a little with you. This is not a skill that you'll learn for your checkoff, but it is a skill that you'll use almost every day in clinical. Almost all of your patients will be on a pump, and so it's very important that you come into the lab and that you practice. So we can make it look easy, but it's important that you practice. The tubing is expensive. We don't want you to contaminate it in clinical practice. That cost goes to your patient, and there's special tubings that are used. So we're very lucky to have the Alaris pump here in the nursing lab. So you're going to identify the right tubing. So it's very important that you select the right tubing, and you'll notice that it has I always tell the student, it has a little blue cap at the top, and I call this the biscuit. And then it's got a piece of protective plastic over the part that's stretchy. I'm not going to open this, but you need to make sure that you pick up the right tubing. And if you're not certain, please make sure you ask your RN. And normally we're not running with a micro drip. We're running with the macro drip, the large drip. So this patient has come back from surgery. He's being admitted to the unit, and we need to put the patient on the pump. So they've come from their stretcher. We've put their tubing here that they had from the previous IV, and we're now going to hook them up to the pump. So I'm going to first of all show you the pump. So I always make sure with the pump that I always cut this off first. There is a mechanism so it don't run everywhere, but lots of times we're running insulin drips or aminophylline or whatever with the pump, and I always make sure as a double safety feature that this is clamped off. So I'm going to open the pump, and I'm going to show you the tubing. So here's the little blue hat, and here's what I call the biscuit, right? And it's blue to blue. So when you prime it, it's really important that, again, that you get the air out. So you can see there's extra filters on this one, and sometimes quite resistant to the bubbles. They stay in there, and then they seem to coalesce, and the next thing you know, the pump is ringing and ringing because there's air in the line. So when you do it, flick, turn it off, turn it back on, flick, so that you get all the air out. And that way it's not ringing and ringing. We're going to go ahead and put the tubing into the pump. So the little blue hat sits on top of the pump. Just rests nicely on top. And then I call this part the biscuit, and I say the machine eats the biscuit. Then you're going to push in, and you have to use a fair amount of pressure and push down. And now your pump is ready to go. Please make sure that the pumps, when the patient is next to an electrical outlet, the patient is connected, because the battery will run down. So we're not going to use this tubing for the patient, but I do want to keep this line because this is new for the patient and it's expensive to change it out. So I am going to lower my primary bag down and hang it up, and I'm just going to transfer this over. So before I do that, I'm going to get my alcohol swab out. Always carry a whole pile in your pocket. So and then I'm going to get rid of that line. If there was a lot of solution left in this bag, I would also use this bag. I would move this bag over, and I can show you how to do that. So I am going to hang this high, unplug this, and the port you're looking for is the one above the machine. And what you need to remember is that the medication runs through the machine. So you're not picking a port that's lower than the machine, you're picking the port that's higher. So again, clean really well. Lots of times you're going to come into the agency and this has been just left hanging like that. That would be considered contaminated and you couldn't use it. Sometimes you'll see the nurses, I'm just going to show you this, have taken this tubing apart for some reason. They've got the little alcohol swab in here, and they put this like this. That's considered contaminated because this is not sealed. So you'd have to get a new tubing. So you're going to see all sorts of different things with your tubing that you need to assess whether in fact you can use it. So still in my view, haven't touched it since I cleansed it. I'm going to attach the secondary to here. All right, this is turned off. If I wanted to use this bag, I'm just going to turn this off to the patient. I want to use that bag of solution. I wouldn't have this hanging. I'm going to unplug that. Be careful not to squeeze it. I still have a little mini bag of solution there. Well, this is running to the patient, but I've sort of slowed it right down. This would not be here. This would just be my spike covered with the plastic cap. And now this is more like what it's like in clinical. I don't know how many centuries this has been on here, but then I stand it up here so it doesn't run all over the floor. Sterile to sterile. So I could use, if this was a, close to full bag, I could just use this patient's bag of solution. And now I'll hang this up. All right, so I got the right primary solution. I'm looking at the physician's order. I've got the tubing for the Rocephin. I'm going to have to put a label on this when I'm finished to make sure that I label both of these. And I need to now hook this patient up to the new IV. So I'm going to put my gloves on. Get a pair of gloves here. And this patient has an extension tubing. So because they have the extension tubing, I really don't need to wear gloves. If I was fiddling around here down at the hub, I would. So it's your personal preference. So I'm just going to come here now, undo this. I'm going to change out your IV tubing. I'm going to find my tubing here for my pump, which has been well primed. Take off the cap. And you can keep it between your fingers, or you can get rid of it, but keep it so it's still sterile in case you need it. Undo this. Whoops, and that would be considered contaminated. We have to do that again because I touched it. All right, so I'm going to undo this. And sometimes you get lots of pushback, so hold tight and then secure the lure lock. So this tubing now is trash. The patient is into their tubing for their Alaris pump. I need to retape the IV and make sure that it doesn't get kinked. Doing okay there? So remember your patient in all of this. For them it can be really anxiety provoking. And there we go. So now we have a patient. I'm going to remove this and put it in my sink so that it can drain out. And now I'm ready to turn my pump on. So, system on. And it will take a minute to warm up, and most of the pumps are set up in something similar to this manner. If it makes a noise, I always think it could be the middle of the night, turn that to hit the yellow button and that will silence it. New patient, no. Medical, surgical, yes, or sometimes it'll say med-surg tele. These are channels. There can be more than one of them. We just have one, and it's channel A. And it's asking you for channel A, so I say, when in doubt, press channel select. So when we do that, it brings up a menu, and we're looking for just guardrail IV fluids, and we've looked at our doctor's order, and we know that this is running at 75 an hour. So I'm going to come over here to guardrail IV fluids and click on that. Now I'm going to be looking for whatever the agency policy says and how they lay it out. This one says IV fluids plain. If you were at Corpus Christi Medical, it would say IV fluids maintenance, and then you have choices. So IV fluid plain, yes. And then I always say where there's a box, you need to fill something in. So start with the volume to be infused. If this was a full bag of solution, I wouldn't want to put 500 mils because I want to give the nurse time to come and get a new bag. So I've got 100, 200, 300 and a bit. So I'm going to put in here my volume to be infused, 250. It's going to ring before that bag goes dry. I'm going to come here to the rate. I'm going to click on the rate. The order was for 75 an hour. I'm going to put in 75. Whoops. Clear that. And put in 75. So I hit the cancel there. The 7, for whatever reason. There you go. It's got to be highlighted. So hit the rate again. 75. Just make sure you're pushing it firmly enough. And then it says start. Now you want to make sure that this is fully running, because remember we had it turned off when we first started it. And not only do we open the clamp, but we want to make sure that it's not pinched here. This is a little firmer tubing than the other tubing. So sometimes if it's been off for a while, you've opened it, but it's still pinched off. And follow all the way to your patient to make sure that, particularly if you've hooked this patient up, they haven't been previously hooked up, that the slider is open. Otherwise it's not going to run. So you should now see that the IV fluids plane are running at 75 an hour. This is running, everything looks good. Now before we finish, and you can see that I have a little bit of air in this line. Fortunately, it's not up here. But we would, to get that out, we would disconnect the patient here, and we would run that fluid out to get that air out. And then we would hook them back up. So I'm going to do one more thing before we leave you, and that is I'm going to hang another medication. So remember, this is running. Everything is good. I'm now coming in with another medication. And it's vancomycin 500 milligrams in a 250 ml bag. Now sometimes when you get medications like this, they need their own tubing. You can't use, they're not compatible with anything. So you have to run with another tubing. So you need to be very knowledgeable about your medications. So I'm going to just reinforce what we did before. It's always best if you can sort of clean up as you go. And I'm going to show you in a clinical setting what I would do with the garbage. So we don't need this, so we can just go in the garbage. But if I didn't have a garbage pail close by, I'll show you what I do with my caps. So again, first time you open a tubing, make sure you clamp it off. Otherwise that medication, which is expensive and precious, is going to get all over the floor. So this is again a little different than the last one that we had. I like to get rid of everything, get it out of my sight, so the only thing I see is what I need to deal with. Pull off the cap, and you don't want these in the bed, you don't want them in a crib for pediatric children, you don't want them on the floor to fall. So there's a lovely spot up here on top of the pump where you can put your garbage. And then at the end of this you can clean it all up so everything is good. So sterile to sterile, pushing this in. So now I'm coming to this patient, and I'm going to hang this medication now. That one is through and finished. We'll say it's empty. The only thing that's left is a little bit here in here. The normal saline has been running to the patient, so I know there's no Recephin in the line. So I'm going to hang up my Vanco. And now I want to keep this tubing sterile because I don't want to, it's good for 96 hours. So what I'm going to do now is I am going to put this cap onto this one. And I'm just going to go back and forth as I hang different medications during the course of the day. So remember, the first thing that you do, if it's not already done, is make sure that this is clamped off. If you don't, all that solution is going to get all over the floor and all over you, and you don't want to get that on your skin. So the first thing you're going to do, clamp it off and undo this. Keep this sterile, let that go. Try only to hold what you need to hold. Take this cap off, put it on here, and put this up here. So that Rocephin, and we'll have a sticker on it saying that's good for 96 hours. And remember, in the same day, they probably didn't put the label on, so it's up to you as the nurse to do it. Now I'm going to take my alcohol swab. I'm going to clean the end. Keep everything in your sight. Remember, below your shoulders, above your waist. If you can't see it, it's not considered sterile. And then I hook this in. Now, what's in here? Air. So if I open this up right now, I'm going to give that patient all that air. So again, I'm going to do flashback or the lowering down method. So I'm going to come back and I'm going to lower it down. It's still closed. The clamp is still closed. Remember, the fat is open. The skinny is closed. Now I'm going to open it. You're going to see the bubbles go in. See the bubbles go in the bag, and you can see the fluid is coming up. It's going to half fill that drip chamber, and we'll be ready to go. The lower I hold it, the faster it goes. Then I'm going to turn it off when it gets halfway full. So let's see if this medication is actually in the machine. So you'll notice that when we look at the machine here, the IV fluids are running, but there's no other menus or anything here. And what we're going to do is we're going to hang a secondary medication of vancomycin, and we need to find that. So when in doubt, hit channel select. And when you do that, you'll see that the secondary menu appears. Then you're going to click on the secondary menu. And you're going to, everything's by alphabetical order, so V, U, V, W. Okay, there's vancomycin there when I go down my alphabetic list. If it's not there to start, you can page down. So you can go through a whole lot of medications that maybe start with C. There's vancomycin, and then it says how much are you going to give. And this says 500 milligrams, and we'll say that this is an 100 mils. So that's the right strength. And it asks you again, is that what you want to give? And you say yes. It tells you the concentration, which you can work out to make sure that the pharmacist has done it right. And then you go to next. And then it says that you can run it over 30 minutes. But when I look at the label that's on here, the pharmacy wants me to run this over 2 hours. So again, I can find the duration box. Remember, anytime there's a box, I can put something in it. I'm going to hit 2 hours here. I'm going to put 200. And when I do that, it's going to change my volume to be infused. And then I'm going to hit start. And you'll notice here it says, verify the secondary clamp is open. So I always hit start first. And then the last thing I do, just like I did with the primary line, is make sure it's fully opened. And again, that it's not pinched off. And this should run. And if it doesn't, occasionally what will happen is you'll get an airlock in here, which is exactly what I have. And so if it's not running, if you're not seeing that bubble, you may have to do some fiddling to get that little airlock out of there. And when you do that, there you go, it should start to run. So now you can see that it's running. It's saying that the secondary is running, and it is vancomycin. And again, the same checks are in place that you checked this patient before you gave it. You check their allergies. I always look and say, has this patient had this medication before? Because if they haven't, I'm really, really watching them. And then I know how much, this is going to go over 2 hours. So I know that I'm going to come back in 15 and check this patient. And then in 30 minutes, I'm going to see how much is gone. And by an hour, half of that should be gone. So your assessment does not end just because you hung the medication. That's only the beginning of what you need to do for your patient.